Ito na ang second part ng ating vlog tungkol sa pre-employment medical examination. Nood na! Guys, I'm Doc Mertz and welcome back to my YouTube channel. And again, if you haven't subscribed yet, mag-subscribe na po kayo, watch my videos, like my videos, share my videos, and hit the notification bell for you to be posted to all of my upcoming vlogs and adventures. So, ayun na nga, for this episode, we will continue with the discussion regarding sa pre-employment medical examination ng mga job applicant. So, ito na yung second part. But if you wanna watch the first part, yung tungkol sa mga PE findings natin, I'll put the link in the description section para mapanood po ninyo. So, for this second part, we will proceed with the laboratory examination findings sa mga pre-employment medical exam for job applicants. Ano-ano nga ba yung kadalasang nakikita sa mga laboratory results ng pre-employment medical exam na nagpapapending sa mga job applicants. So here we will be talking about the CBC results, the urinalysis, fecalysis, chest x-ray, and iba pang mga laboratory parameters. And pag-uusapan natin kung ano yung posibleng mangyari sa iyo when you have findings doon sa mga tests or sa mga parameters na ito. So, disclaimer lang po, lahat ng medical and laboratory findings na lumabas sa pre-employment medical exam will be examined carefully by the evaluating physician. And it is on a case-to-case basis. So, depende po yan sa presentation ng patient and the requirement ng company kung isang applicant ay ide-refer, ide-defer, o fit to work. Number 1, complete blood count o CBC. Kung ang patient po ay anemic o mababa ang hemoglobin, hematocrit, and RBC levels, we advise them to repeat the test after a diet of high in iron or ferrous sulfate supplement. Kung maganda na improvement with the patient's anemia, we fit them to work. Pero kung ganun pa rin and significant yung kanyang anemia, we give them a referral for an IM hematologist clearance. Any sign of infection sa dugo, we treat, but we look also to the clinical manifestation of the patient. Then we repeat the test after a week or 2. Pero kung severe yung blood dyscrasia at talagang merong ibang sintomas si patient, automatic yan, IM hema clearance na agad yan. Next, urinalysis. Well, we don't do urinalysis for female patients na merong menstruation. Urinalysis must be done 5 to 7 days after the last day of their menstrual period. Okay? Para mas accurate yung reading. Now, if the urinalysis results reveal na merong urinary tract infection or mataas ang pus cells or WBC sa urine ng patient, we just prescribe medicine. Then we advise the patient to repeat the test 1 week post-treatment. Now, if there are sources or if there are signs of or tracings of glucose and protein in the urine, we also advise the patient to repeat the test maybe after a week. Pero kung meron po talaga, we refer them to the specialist. Kung may protein, usually IM nephro ang aming binibigay na referral. And if there is glucose in the urine, we give referral to IM endo for workup sa diabetes. Fecalysis or stool examination. Simple lang, kung merong parasitic infection sa stool, we just treat the patient and ask them to repeat the test a week after treatment. Kung may massive bleeding naman, and if we suspect more serious problems in the stool, we give them referral sa mga IM gastroenterologist. Pakiusap lang po. Wag po natin pepekiin ang pagpasa ng stool sample sa mga laboratory at sa mga industrial clinic because automatic pag ginawa ninyo yan, unfit na po kayo. Oh, no! And make sure that the stool samples that you submit are freshly collected para hindi masayang ang effort nyo. Chest x-ray. Nako, dito marami nagkakaproblema. Well, for chest x-ray, if there are serious findings of infections like tuberculosis, pneumonia, pneumonitis, etc., automatic yan. We refer the patient to an IM pulmonologist for clearance. At lalo na ngayon, COVID season, kaya medyo mas mahigpit tayo sa mga pulmonary findings. For TB, if the patient has already treated his or her tuberculosis, we advise them to bring out their old records para mas mapag-aralan kung kailangan pa ba ng clearance. If the patient is currently treating for TB, pulmo clearance pa rin yan. Pero kung suspected pa rin ng TB, i-work up ang patient kung talagang active an infection, then we give them referral to pulmonologist for clearance. So, ganun din sa pneumonia, pneumonitis, and other pulmonary infection, pulmo clearance po tayo. Kung scoliosis naman, ang finding sa chest x-ray ng patient, we refer them to an orthopedic surgeon for clearance. Kung cardiomegaly naman o malaki ang puso, IM cardiologist ang bibigay ng clearance sa iyo. Well, magandang tanong yan. If your chest x-ray or your latest chest x-ray is less than 3 months, we advise the patient to bring the plate and the reading para mapag-aralan kung kailangan bang ulitin. If it's normal, walang problema. But if there are serious findings doon sa iyong latest chest x-ray, babalik po tayo sa referrals. Drug test. Well, there are companies that require this testing, pero there are companies din naman na hindi. I'm not sure, pero parang the law states that drug testing and HIV testings should be voluntary and hindi dapat siya mandatory. Now, if you turn out to be positive for drug test, isusumbong po namin kayo kay Idol Rafi Tulfo. Patients with positive drug testings will undergo confirmatory testing and will have you refer to the DOH care of testing hospitals at syempre, unfit to work na po kayo. Pregnancy test. Positive pregnant patients will be given referrals for an OBGYN clearance. But mind you, there are companies who don't really recruit pregnant applicants. So, unfit na sa kanila yon. I'm not sure if it's ethical, pero yun yung qualification nila. And there are really lots of job applicants na dun lang sa mismong pre-employment medical exam nila na nalalaman na pregnant sila. And matutuwa ka kasi iba't iba yung reaction ng mukha nila. Alam mo kung sino yung planado at sino yung unplanned ang pregnancy. Yun lang. Hepatitis B screening. Patients with reactive results will be asked to undergo Hepa B screening to determine the rate of infectivity. And bibigyan din natin sila ng referral for IM gastroenterology clearance. Yun. And lastly, HIV screening. Patients who turn out to be reactive will be given or will undergo confirmatory testing at bibigyan natin sila ng referral to the nearest DOH HIV testing facility. So yun po yung mga usual test na ginagawa sa mga pre-employment medical exam sa isang industrial clinic. But there are other tests na ginagawa rin natin, depende po yan sa requirement ng company. Now, how do we classify the job applicants pagdating sa final evaluation nila? Ito po. Class A, Class A, physically fit for any work. Ito yung mga job applicant na pasok sa medical requirement ng mga company na pinapasukan nila without any limitation. Class B, physically underdeveloped with correctable defects but otherwise fit to work. Ito yung mga patient na may mga minor problem na hindi na kailangan ng clearance or yung may mga medical condition na nakapag-present naman ng clearance nila. Class C, employable but owing to certain conditions or impairments. Ito yung mga job applicants na maraming special consideration pagdating sa pagtatrabaho. So, medyo limited lang yung assignment nila or may special placement sila doon sa trabaho because of their debilitating condition. So, those with congenital deformity, mga heart defects or illnesses, at iba pa. And they are required to do periodic follow-ups or check-ups sa mga attending doctors nila sa labas. Class D, unfit. So, hindi pumasa, bagsak. Medyo masakit yan, but these are the applicants who are unsafe for the working environment, especially pag active yung kanilang illnesses in advance. Example, active tuberculosis, mga malignant hypertension, and advanced heart diseases. Hindi na talaga pinapayagan yan magtrabaho para hindi lumala yung sakit nila. Well, I hope marami kayong natutunan because that concludes our discussion regarding sa pre-employment medical examination. But if you still have questions, please key in or type them in dito sa comment section ng video na ito and I will answer them. Okay? Well, thank you for watching my video. Again, mag-subscribe na po kayo. Watch, share, like my videos, and click the bell button for you to be posted to all of my upcoming vlogs and adventures. Hanggang sa muli, thank you for watching and bye-bye.